If you've ever experienced a dental emergency, you may recall that feeling of pain and panic just after it happened. What do I do now? Do I call my dentist? Do I go to the emergency room? Do I lay down and cry? Not to worry, we're here to help. The first thing you should do if you experience a dental injury is take a deep breath and give us a call right away. We leave room in our schedule every day to accommodate emergency appointments, and the doctor is on call after hours if needed. We're here for you when you need us. If you're dealing with a broken or knocked out tooth, a soft tissue injury like a badly bitten lip or cheek, or signs of infection or abscess like pain and swelling, it's safe to say you are in need of immediate emergency dental care. If you're still unsure, just give us a call and we would be happy to assess your situation. If you've knocked out a tooth, you should locate the tooth, pick it up by the crown and not the root, and rinse it with water. Do not remove any attached tissue, do not scrub, do not use soap, and do not dry it off. If you can place the tooth back in the socket, this is the best option for preserving it, but make sure it's facing the right direction. Otherwise, you can place the tooth in your mouth to keep it moist, or place it in a small container of water, milk, or emergency tooth preservation solution until you can get in to see us. Your tooth has the highest chance of being saved if we can get it back in the socket within 1 hour of the incident. Similar to a knocked out tooth, you should locate any broken pieces and rinse with water. Preserve the piece by placing it in your mouth or in a container of milk, water, or emergency tooth preservation solution. Rinse your mouth out with warm salt water and apply a cold compress to reduce pain and swelling until you can get in to see us. If you are bleeding from the tongue, cheeks, gums, or lips, you should rinse your mouth out with warm salt water and use moistened gauze or a tea bag to apply pressure to the area for 15 to 20 minutes. You can also use a cold compress to help stop the bleeding, reduce swelling, and relieve pain until you can get in to see the dentist. If you're experiencing a toothache or signs of infection like pain, pus, or swelling, you should rinse your mouth with warm salt water. Floss gently to dislodge any food particles that may be causing the problem, and apply a cold compress to reduce pain and swelling. A toothache and signs of infection may be caused by an abscess or exposed nerve that should be treated as soon as possible, so call us right away. If you've lost a filling or a crown, save the piece if possible, rinse it, and bring it in with you to the dentist. If you can put the crown back in place, make sure to rinse it first and use dental cement to secure it in place. Avoid chewing on the affected tooth in the meantime, and use sugarless gum or dental cement to protect the area. You should always rinse your mouth with warm salt water to inhibit bacteria and promote healing. You can also apply clove oil to the affected area, as it contains natural anesthetic and antibacterial properties and can reduce inflammation. A cold compress is always a good idea to help ease pain and reduce swelling, and acetaminophen can be used as well, but please avoid aspirin or ibuprofen as these can reduce clotting and cause excessive bleeding. Unless you are unable to stop the bleeding or your life is in danger, you should always call us, your trusted emergency dentist, first. The emergency room is neither trained nor equipped to properly handle dental injuries. Skip the line in the hospital bill and call us first. If you or a loved one has experienced a traumatic dental injury, we would love to help you get out of pain and save your smile. We're here for you when you need us, so give us a call.